You're listening to the Ethos podcast.
Hi, my name's Dr. Nick Broughton. I'm Managing Director of Ethos Pharmaceutical Ethics Compliance, and welcome to this Ethos podcast, where today I'm joined by Dr. Ravi Pawa, who's a fantastically experienced pharmaceutical physician, has worked at senior levels in UK pharma, and is a highly experienced signatory and decision maker when it comes to ethics and compliance. Today we are going to discuss, myself and Ravi, the thorny topic of pharmaceutical company congress activity. Our approach to congresses as an industry has been pretty stable for quite a long time now, but there's been a couple of things recently that's got people questioning what they need to be doing, so we're going to have a chat about that. There's two things at issue, really: whether the code applies to presentations given by UK clinicians at European congresses or international congresses when that clinician is employed by an international organisation. Does the UK code apply if UK delegates haven't been invited to the meeting by a UK company? And secondly, the second thing at issue is who's allowed into Congress exhibition areas, which has become an issue since the recent guidance from the ABPI itself about that topic. So let's take the first question first, as is traditional. Ravi, let's look at the issue of approval of presentations given by UK speakers at international congresses. What's your thought on whether the UK code should apply to the presentations?
Great question, Nick, and thank you for asking. So my feeling is that if the speaker is a UK clinician but has been contracted and instructed by your regional or global team with no input from the UK, the code should not apply. Mm-hmm. Because the UK hasn't been involved, they haven't instructed them in what to do, and the conference itself is not in the UK.
Yeah.
And as long as also, as you said, the UK team have not invited UK delegates to that presentation.
Yeah.
Okay.
Yeah.
So all those things, if they're in place, then I feel the code should not apply.
Yeah. Sorry, carry on.
Yeah, I think if the code were found to be applicable, I think that makes life difficult for the UK to be in the science and research at the forefront, because UK speakers will be invited less. We know that, right?
Yeah.
Our regional and global teams will find it much easier to invite speakers from other countries because the UK, they won't have to go through that whole certification process.
Yeah.
And I think that's kind of important, that UK clinicians feel valued as part of the world of science and medicine.
Yes, I mean, I'll be honest. I feel we're isolated enough at the moment, as between UK and Europe. I tend to agree. I think nobody would argue that if you have invited clinicians, delegates to a meeting as a UK company, to an educational, to a promotional meeting, then the UK code applies to that meeting. But to me, it applies to every presentation. The nationality of the speaker is irrelevant. It doesn't matter whether it's a French speaker or a German speaker. If you've invited people along, then everything has to be signed off and all the presentations have to be signed off. I think if you haven't invited people as a UK company, and your European organisation has invited a UK speaker and dealt with them, and then I don't see why you should be accountable for that speaker's presentation. What the argument seems to go in, from the detail given in clause 8.2 of the code, that if it's a UK speaker and there's a UK delegate in the audience, then the UK code applies, even if it's just somebody who happens to wander in.
Yeah, and I think that makes it very difficult.
Yeah.
Because 8.2 also says it applies if the global team have appointed that speaker via the UK team.
Yeah.
And therefore, if they haven't used the UK team, then it doesn't apply.
Yeah.
And now in any conference anywhere in the world, you can't stop people walking in, right?
No.
Unless you have a lot of bouncers, lots of coded name badges. I mean, the list
Yeah.
goes on.
Well, then we're setting the UK apart again. You know, if you're
Absolutely.
from the UK, you can't come in.
Yeah.
Anybody else at this Congress can wander in. That doesn't seem acceptable.
No.
And again, if we're worried about what the UK delegate hears, that person who happens to wander in, who hasn't been invited by the UK company, we should be signing off all presentation. Why does it make any difference whether the speaker is, from the UK or from Germany or France or whatever? So it doesn't make any. The idea that that we have to sign off every presentation if it's a UK speaker, and we would have to because there are UK delegates coming to all congresses, doesn't make any rational sense to me.
No. Already, if we're barring UK delegates from attending some symposia and some scientific sessions, that can impact our expertise and knowledge and learning.
Yeah.
So no, fully agree. With all the provisos we've talked about, we should not have to certify things where the UK has not been involved.
That we can't be expected to control everything as a company. I think that the one area where there might be a case, I'm not sure where I am on this necessarily, for the UK to a code apply, is if at a Congress there's a promotional stand and a UK delegate is handed an invitation to a promotional meeting by somebody on the stand. Now, there is an argument that means a UK person has been invited by the company and therefore the UK code should apply. So I can see that justification. I think it's a bit over the top personally, but I can see that it's an argument that could stand. But I think we need clarity on that, because then we need to be telling representatives on stands, if it's a UK person, you cannot invite them to the symposium.
Yes.
That would be the way around it. Yeah.
And a very good briefing document with training for your team that are at the Congress and at the stands would help.
Yes.
That. But then you've also got congresses where flyers will be inserted into the Congress bag.
Yeah,
right?
yeah.
You can't stop.
You can't. I know it's very difficult. It's like whack-a-mole, isn't it? It's there was obviously a fairly recent code case reflecting this, Beijing versus Janssen, where Janssen, essentially the point at issue was whether Janssen should have signed off the presentation given by a UK speaker, even though they hadn't invited anybody to the meeting. Janssen's position, and which I agree with, to be honest, was that they didn't need to do that. But the panel found that they were in breach on the basis that they had taken some delegates to the whole Congress, though not invited them. That to me is irrelevant, if I'm being honest, because I think that's a separate activity, supporting education. And we're encouraged to keep supporting of education and promotion apart. So it would seem odd to link them in that way. But the shame with that case, to some extent, is that we didn't, when Janssen appealed, we didn't get a definitive answer to the question whether the code applies, because there was a technical reason why the wrong clause had been applied. So I think we're waiting for more guidance ultimately on this. The question that I get is, well, what should we do in the meantime? Okay. What would you do?
Thanks for putting me on the spot there, Nick.
Yeah.
But I would personally say carry on. As long as you do not invite anybody from, if your global and regional team has sorted that UK speaker, you keep out of that activity. If you're involved in the activity, then absolutely certify.
There is sort of a middle ground, isn't there, really, there, where I can see, if I was a medical director of a UK company, I'd want my global team to be telling me about UK speakers I was taking. I personally don't see an issue with the UK organising the arrangements for the speaker.
Yes, that's okay.
Which would have to be within code, the payment and the accommodation and things like that, but not have to sign the presentation off.
Yes.
Do you are in that?
I agree.
Yeah.
And again, when you have, if the UK has stands and a presence at that Congress, you would instruct your teams not to invite UK delegates to that symposium.
Yes.
Right.
Yeah.
And that's fine.
Yeah. Yeah. So have a bit of courage.
Yeah,
carry on if you believe.
Have a bit of courage. Carry on, because and again, Janssen were right to appeal.
Yeah.
Right? Absolutely right to appeal. Shame that it was the technicality.
Yeah.
But I do feel that if it happened again, as long as the UK has not had that level of involvement, if the PMCPA found a company in breach, it would cause furore.
Yeah.
Right? It would. I mean, as we've talked about the UK setting itself apart and the consequences.
Yes.
I might be proven wrong in a year or two. But
yeah. But I think if we're doing something different to everybody else in Europe, and it doesn't, again, it's just just doesn't make natural sense to me that we're worried about what a UK speaker is saying to a UK delegate, but not about what the other speakers are saying.
And also, it goes back to intent.
Yeah.
Right. If there was no intent to promote to UK HCPs, then your activities, as long as you conduct them all within the code, should be okay.
Yeah. No, no, that's great. Well, let's move on to this other Congress conundrum, if you like. Recent guidance from the ABPI that maybe where FPA is going as well in the future is suggesting really that companies must do more to prevent essentially delegates to congresses from having access to the promotional exhibition, essentially. To me, I call it sort of the bouncer question. Again, we're about, how do we have bouncers on the door, different coloured tags for people who are healthcare professionals versus non-healthcare professionals, and we stop certain people going in. Not something they've done before. What do you feel about this one?
Great question. There's two bits. So firstly, again, I always come back to intent. So the intent and the reasons behind that rule are good and sound and ethical. You do not want a person who's been exposed to promotional content, who's not an HCP, going to the doctor and say, I want that medicine because I saw it on the stand.
Yeah.
Right?
Yeah.
That would be wrong. We all agree on that.
Yeah.
So the reasons behind that are sound. But in practice, if you've invited people to a congress, or people have paid and come to a congress, it's very difficult to separate them from the exhibition hall in reality, right? We've been to numerous congresses. Sometimes there isn't the physical space to have a different hall for, let's say, tea and coffee.
Yeah.
Right. Or lunch. And you can't say to people, you can't have any catering because you're not allowed in the exhibition hall.
Yeah.
So sometimes common sense has to prevail.
Yeah.
You can take reasonable measures. So again, good guidance documents for people manning the stands, like not handing out flyers to people.
Yeah.
But again, that becomes difficult to enforce unless you have different coloured badges. And the more complexity you add to something, the quicker it'll go wrong.
Yeah.
Yeah.
Yeah. No, I think common sense is very important. I also think the way I look at it, I've got to say, is that essentially, there are two elements when we're about the prohibition on promotion to members of the public. The first bit is that we can't have an intent to promote to the public, like you said. Talk about intent. So no member of the public, or no delegate going into an exhibition area, if they're not a healthcare professional, we should be attempting to influence.
Yes.
And most representatives are briefed not to check who they're speaking to, and if it's a member of the public or somebody who's in that category, they don't brief them on the medicine. I think that's appropriate. But also, I think there's also this sort of not being careless with your promotion, so you inadvertently expose people. And in that way, I personally think, if you think about congresses, there are actually three groups of members of the public that we have to think about. There are members of the public wandering around outside the Congress Centre, near the Congress, everyday members of the public in the absolute sense.
Yeah.
Clearly, we've got to make sure they don't see anything that's promotional. There's no banners up and things like that. Well, that's fairly clear. Then there's a group of members of the public who are always exposed to promotion at congresses, and that are people who are working in the Congress. The people cleaning, the people building stands, most of the members of most of the people in the pharmaceutical industry working there are members of the public, but they have to see promotional material. It's unavoidable, and we're pragmatic about that because they're working there. And those two categories, I think, are clear. The category that's not clear is this delegate members of the public. And from my perspective, to this pragmatism, provided we're not intending to influence them, which we shouldn't do, and we're clear that this is intended for healthcare professionals, which is a rule we apply in lots of other places, like websites, then I don't see that this is a massive harm, that we need those bouncers on the door, but it may be something coming.
Yeah, I agree with you. I think pragmatism comes into it, and again, using the code as your foundation for briefing people at the stands about, as you say, not handing out things to anybody without checking who they are.
Yeah.
But if you step back and think, why are all these people that are not HCPs at that Congress? They're there for very good reasons.
Yeah.
For their own education, they may be on a panel, they may be speaking, and they're involved in that therapy area, they're involved in the science. So for them to see some of the pharma content, I don't see as a massive problem.
No, it's not an issue.
And some of them are there to interact with pharma.
Yeah.
They end up talking to pharma people, not reps, but just people, and end up collaborating. They might find a new research project. They may be looking for ways to fund some really important research they're doing. There may be patient advocacy groups who need to know what else is going on in that space.
And the medical stands, which are non-promotional, are often in the same place.
Exactly.
And, an unsolicited inquiry, the nature of the inquirer is not that important from a compliance perspective.
Yeah.
We are allowed to answer the question, and we're denying those people access to that, researchers and other people.
And the non-HCPs that are at congresses are there for very good reasons. They want to learn more science. They need to know what's at the forefront of research. They're also there for networking.
Yeah.
And a lot of the networking will go on in the exhibition space, where there are medical stands, commercial stands, other stands. And that's where they will meet some of the key opinion leaders. They may meet people that they can collaborate with, do some exciting new research that will really benefit patients.
Yeah.
And I think to exclude them from that space completely is difficult.
Yeah.
In large congresses, you may be able to have two spaces, one for promotional, one for non-promotional. But even that, I think, will stop some of that collaboration.
Yeah, and that interaction. You're right, it's actually quite a social networking space, isn't it? And congresses need that. So that's an interesting perspective. I think the thing I worry about sometimes as well are the knock-on consequences of this. If we're saying that we've got to absolutely exclude people who might be classed as members of the public from exhibition areas, well, does that mean we have to absolutely exclude anybody, medical students, for instance, or researchers from coming into a promotional meeting that's been organised by a representative, say? Do they mean they have to stay, no, you can't come in?
Yeah.
I think we've tended to take a pragmatic view that provided they're clear it's for healthcare professionals, there are, people aren't going to sort of throw themselves in front of them and kick them out. And even websites, it's going to affect our approach to websites, where we allow members of the public, if they want to click I'm a healthcare professional, they can at the moment. Is that going to have to change? I see there are some knock-on consequences from this.
I worry about that, because at the moment that is a self-declaration.
Yeah.
So again, for congresses, we can be pragmatic and have the same kind of self-declaration that, on the doors leading into the congress area. You're now going into the exhibition space, there will be some promotional materials there.
Yeah. It's pragmatism.
You can elaborate on that statement.
Treating people like adults as well, I think, to some extent.
Yeah.
Interesting times, and more guidance, I'm sure, to come. I think some more guidance is coming from the ABPI. I'm sure there'll be more code cases along this line to define the rules. Thanks very much for your thoughts. Thanks,
Thank
Ravi.
you.
Cheers.